Good evening, everybody. Welcome to another episode of Uncommon Sense with Jose Negron. Now, for the benefit of those of you who are not familiar with this channel or watching this channel for the very first time, the reason why it is called Uncommon Sense because here on this platform, we discuss everyday issues where we try to find logical solutions. Unfortunately, not everyone uses logic. For that reason, it is called uncommon sense. I just want to let everybody know that I'm currently live on YouTube, Facebook, and Twitter. I do apologize for my voice. I am dealing with a cold, so I'm gonna just do the best I can, um, because to show must go on. First of all, I just want to let everybody know that I want to give a huge shout out to all those who have already subscribed to the channel. I also want to give a huge shout out to all those who follow me on social media. And I also want to give a huge shout out to all those who allow me to enter in your devices. So, what I'm going to ask is the following. If you have not done so, please subscribe, like, and hit the bell notification to all. So therefore, whenever I do prepare content, you will have the opportunity to either catch it live or catch it on the playback. Once again, the subscriber mode is on. What does that mean is if you're not a subscriber and you wish to enter a comment, you need to subscribe to the channel. It is not a big thing. And when I ask it, please subscribe and hit the like button as you enter. Now, again, I'm going to share with you what are the rules regarding this platform. Number one, please be respectful to everyone on the panel and on the chat. Number two, please don't overtalk anybody on the panel. Okay, if I see that one of you is over talking, I'm going to ask you to please try to wrap it up to allow other people to speak. And number three, if anyone decides to use uh, as an avatar parts of female or male private anatomy, you will be removed from the chat. It is that simple. Now I see here that tonight it's a busy night regarding streams. Um, I believe Don Armando is doing the stream right now. And of course, Joaquin is going to be doing his stream, I believe, at 9 o'clock Eastern Standard Time, which is 8 o'clock Central Standard Time. So, what I'm going to do is I'm going to try to keep this stream under 2 hours. So, therefore, I and everyone else who are part of the common folk can participate in the stream. Now, the topic for tonight is the high cost of medical coverage. Uh, why are we discussing that? Okay, the fact of the matter is, it's going to be more and more expensive to get medical coverage. Uh, Most of us who are employed get our medical coverage from our employer. However, within the last few years, there have been increases as far as prescription drug costs, also increased fees to be member of these HMOs. So that's something that hits home for many people. Okay, and I've seen my pay decrease because the deductions for medical coverage continue to rise. And now the city of New York, for whatever sense of whatever reason, wants us to start paying premiums on our medical coverage. Okay, now some of you might think that's not a big deal. One thing you need to bear in mind, for the most part, municipal employees, we don't make a lot of money. I mean, depending on the line of work that we do, we can make an okay salary. Okay. However, when you think about the high cost of food, the high cost of rent, the high cost of transportation, okay, your utility bills going up and your heating bill going up, and then you have to worry about paying a premium. Now, in some municipalities, those premiums can be very expensive. They can run to hundreds of dollars per month. Um, Now, right now, my Minnesota union, which is District Council 37, is currently trying to engage with the city for a new contract. Among the demands that we have is no premiums, okay? Also a decent raise, also other demands that we're submitting. I'm not going to get into all the details regarding all the demands. That will be discussed at another time. Now, currently, District Council 37 is involved in a letter writing campaign to let our politicians know about our objection to pay for medical coverage. What I'm going to do is I'm going to try to see if I can share my screen if my computer cooperates. Okay. Okay. Just give me a moment. Okay. Unfortunately, okay. Well, okay. I apologize. Unfortunately, this is the problem when you at the mercy of crappy high Wi-Fi. Okay. So I'm going to give it a few minutes and see. Okay. Now, as you can see by the page, this is the DC37 website. And for those of you who are not familiar, it's DC37.net. Now, there is a legislation called Administrative Code 12-126. Okay. Now, as you can see here, the headline is Protecting Premium-Free Healthcare for City Workers and Retirees. Amend 12-126. Why is this important? Because if we do not amend this piece of legislation, what's going to happen is that not just municipal employees, but retirees will have to begin to pay premiums. Okay, so this is something that's very important. Now, let me just read to you what the caption. Join DC 37 to fight to protect premium-free healthcare. District Council 37 is New York City's largest municipal employee union, serving more than 150 active members and 89 retirees. Our members are New Yorkers who are proud to serve this great city. We do not take healthcare lightly. DC 37 is very proud to promote premium-free healthcare benefits to our members, retirees, and their beneficiaries for life. It's no secret that the cost of healthcare has risen astronomically for decades. DC 37 and the Municipal Labor Committee have implemented a series of measures to bring healthcare costs under control, saving over $3.4 billion since 2014. In our own union, we have done everything we can to save billions of dollars by coming up with concrete ideas to solve this problem. And we continue to do more. Despite these efforts, the cost of healthcare has more than doubled during the same period of time. This is due to a number of factors, including the recent cost of prescription bills related to the pandemic and unscrupulous prices pricing by certain hospitals that continue to charge 300% above the Medicare rate for the same services. Okay, I'm not going to read to you the entire article. Frankly, I don't have voice. Okay. Now this is what DC 37 is asking all of our fellow members to do, and actually you can do the same thing as well. Okay. You can contact your member of the city council, enter your email. Okay, and if you don't know who is your representative in the city council, if you enter your address, you'll find out the council member's office number. Call and then tell them to protect premium green healthcare. You can also write a letter to your council member, and there's a link that you can do so. And you can also share this link with other people, which is what I've done with my social media. Okay. Okay. Now, there are going to be people that say, "Well, I pay premiums, so therefore, therefore, you guys should pay premiums too." Okay. One thing we have to bear in mind: we are municipal employees. We don't work in the private sector. Okay, the private sector is different, and many times the salary will be twice what we make in the public sector. But the reason why we chose to work in the public sector is because we want to serve our fellow men, and we do want to earn a decent wage. So this is the reason why we're involved in this effort. Okay. So what I'm going to do is I'm going to stop to share the screen. Okay. Okay, hello? I apologize. I seem to have knocked myself out. So what I'm going to do is I'm going to drop the link in the chat. If anyone wishes to join the panel, they can do so. If anyone wishes to express a point of view, they can do so. Please keep it respectable, people. That's all I'm going to say. Please keep it respectable. Okay. Now, what I'm going to do is I'm going to share some articles uh, regarding the high cost of medical coverage. I see here there's 3 people watching the stream. I understand that most people watching on the playback, which is fine. So now I'm going to share something from Blue Cross Blue Shield website. Okay. Excuse me. Why does healthcare cost so much? Healthcare spending in the United States is at $3 trillion a year, straining the budgets of families, businesses, and taxpayers alike. Learn what makes healthcare so expensive, why costs continue to rise, and what we can do about it. Let's see what's going on. The price of medical care is the single biggest factor behind U.S. healthcare costs, according to 90% of the spending. These expenditures reflect the cost of caring for those with chronic or long-term medical condition, an aging population, and increased costs of new medicines, procedures, and technologies. Also, healthcare reform has expanded access to insurance to millions of Americans. We have transitioned to a healthcare system in which everyone can obtain healthcare insurance, regardless of age or health status, and many individuals who are newly insured need ongoing medical attention. We can play we can all play a part in helping to make America healthier and curbing healthcare costs. Our healthcare system must focus on more quality care for patients that help them to get healthy faster and stay healthy longer. Meanwhile, everyone can lower their risk of developing many costly chronic diseases by adopting healthier lifestyles. Okay. Now we're going to get into the growth of U.S. prescription drug spending. Prescription drug plays a critical role in helping to prevent, manage, and cure various conditions and diseases. Yet the costs are straining the budgets of families, businesses, and taxpayers alike. Treating chronic diseases account for 86% of U.S. healthcare costs. And now we're going to talk about the high costs of treating chronic diseases. Chronic diseases and conditions such as arthritis, obesity, cancer, and heart disease are among the most common costly and often preventable of all health problems. Americans' unhealthy lifestyle choices are linked to costly chronic medical conditions. Really, how BCBS companies are enabling healthier living and improving healthcare quality and affordability. Okay. Let me just give you my take on all this. It is true that the prescription costs have gone up. And some people pay hundreds of dollars per month in prescription coverage. However, there are certain things we can do to try to improve our health situation and try to reduce the cost of healthcare. Among the things that we can do, which is in our control, is first of all, develop healthier habits. Okay. And I may start as guilty as anybody else. Okay. Okay, what are some of those healthy habits? First of all, try to try to become more active. In other words, try to spend every day taking walks. Okay. Some of you who are able, try to go to the gym on a regular basis. Now, the fact of the matter is, as we get later in the year, the weather does get colder, and some of us may not feel comfortable uh, going to the gym and walking in weather that's not exactly uh, pleasant as far as temperature is concerned. Uh, Sometimes, okay, if you can engage walking, say 20 to 30 minutes per day, and do it on a regular basis, uh, that will help your body a lot. First of all, you will become more active. Second of all, your body becomes stronger and it's better in a better position to deal with the illnesses that we all have to face with. Another thing we can do is make healthier choices. Now, during the holidays, that's easier said and done because when we go to office parties or we go to family get together, okay, first of all, you see a huge buffet table with rich foods, which are high in carbohydrates, high in sugar, high in fat, and high in things where the body does not need. I think it's going to be unrealistic if we abstain from all these fatty foods from whatever completely. What we can do is we can try to make healthier choices. Okay. Like, for example, instead of eating fried chicken, try baked chicken or grilled chicken. Uh, Instead of eating fried fish, maybe some grilled fish. Okay. Instead of eating uh, a lot of pasta and rice, try to get some greens into you. Okay. Now, for some people, eating solid is basically paramount to eating rapid food. However, your body will appreciate it because what you're doing is you're putting healthier food inside of you. Okay. Now, what I'm going to do is I'm going to share another article. Just give me a moment. Okay. Now, I'm going to, this is another article that I came across. Um, and it's a website called Investstopedia. And the name of the article is How Much Does Healthcare Coverage Cost? Where you live and work are just two factors that influence the price. How much does health insurance cost? According, okay, wait a minute, we have someone here, okay, and we have the one and only Nutso. And you are correct. Raw vegetables are very important, okay? Unfortunately, we're so used to eating processed food that the whole idea of eating raw vegetables is paramount to rabbit food. But we have to learn how to eat healthier, okay? And I just want to let everybody know that Nutso TV has his own YouTube, well, actually has multiple YouTube channels. Now, I know I have not been watching his material lately. It's just that unfortunately I've been very busy. I'm going to try to watch his content this week. I'm off next week, so give me an opportunity to catch his content. So I'm going to ask everyone if you have not done so, please check out Nutso TV and his YouTube channels. Now I'm going to continue reading the article. Across the United States, Americans pay widely different premiums monthly for medical coverage, though these premiums are not determined by gender or pre-existing health conditions thanks to the Affordable Care Act. A number of other factors impact what you pay. We explore those factors below to help you to understand how much you might pay for health insurance and why. Many factors contribute to the price of health insurance premiums, including state and federal laws, where you live, where you get your insurance through your employer, and what type of plan you choose. And I see here we also have the presence of Hazel. Good evening. Thank you very much for stopping by. Uh, I'm sorry that you have to go through all that crap on Magic's channel regarding that Kim123 disciple, okay? But we're not going to discuss it here, okay? And I believe you live in Florida, so perhaps you might want to share with us, Hazel, regarding the cost of medical coverage in Florida. Okay. As I stated, mainly. Okay. Don't worry about this. It's okay. Thank you for your kindness. No problem. No problem. You know that I consider you my side my cyber daughter. Okay, and I hope you allow me to, and I hope you allow me to consider you my cyber daughter. Okay, because I do, and I do have a great deal of love and affection towards you. So I hope you allow me to refer to you as my cyber daughter. Okay. Many factors contribute to the price of health insurance premiums, including state, federal laws, where you live, whether you get insurance through your employer, and what type of plan you choose. In 2020, annual premiums for a family for average $21,342, but employees picked up 73% of the cost. No, well, you know what? Uh, but it's true. I mean, I do consider you my cyber daughter, if you allow me to do that. Okay. Um, the rise in employee costs may have been one of the reasons wages have not risen much over the past 2 decades. The highest benchmark plan for premium for a 27-year-old in 2020 was Wyoming at $648. The lowest was New Hampshire's at $273. Deductibles can vary according to the size of the firm you work for or the type of plan you buy on a federal or state government exchange. Okay. Now, there are 10 factors, and again, I do apologize for my voice. So that's the reason why I sound kind of hoarse. Um, Many factors that, in fact, how much you pay for health insurance are not within your control. Nevertheless, it's good to have an understanding of what they are. Here are 10 key factors that affect how much health insurance premiums cost. Number one, state and federal laws. Legislation dictates what health insurance must cover and how much the insurers can charge. Number two, type of insurance, whether you are insured by an employer's group plan or buy on your own is a factor in how much you will pay. Number three, income level. Low wage workers tend to pay more through employers, but may pay less through a federal or state exchange due to subsidies. Number four, employer size. Insurance is usually cheaper at large companies. Number five, state of residence. Premium prices vary depending on the state and county. Number six, type of community. Premiums tend to be lower in urban areas than in rural ones. Number seven, county of residence. Some counties just have just one plan, while others have more competition, which help reduce prices. Number eight, plan type. Preferred provider organizations or PPOs and platinum plans through the federal health insurance marketplace tend to cost the most. Number nine, age. Health insurance rates go up as the policy holder gets older, with the larger increases after age 55. And number 10, tobacco size. Premium size for tobacco users cost up to 50% more. So that's a lot to consider. Now, fortunately for me, I don't smoke. Okay, so that's one habit I don't have to worry about. The coverage offered by employers contributes to several of the biggest factors that determine how much your coverage costs and how comprehensive it is. Let's take a closer look. Okay, so now we're going to take a look at employee health insurance premiums. If you work for a large company, health insurance might cost as much as a new car. According to the 2020 Employee Health Benefits Survey from the Kaiser Family Foundation, Kaiser found that the average premiums for family coverage were $21,342 in 2020, which was nearly identical to the base manufacturer's suggested retail price of a Honda 2022 Honda Civic, which is $22,715. Now think about it. The cost of premiums is roughly the equivalent of a 2022 vehicle. I don't know about you people, but that's insane. Workers contribute on the average of $5,588 toward the hour cost, which means employers pick up 73% of the premium bill. For a single worker in 2020, the average premium was $7,470. Of that, workers paid $1,243, or 17%. Now, the problem with municipal employees being charged premiums, okay, um, once premiums have been start being charged, they never go down. They always go up. So this is something that I wish people who are talking about that we should stop paying premiums, we need to consider. And also another thing, most municipal employees have not gotten a raise in over 3 years. Meanwhile, our rent has gone up, our food has gone up, our gas has gone up, our utilities gone up, but not our salaries. Yes, Hazel, that is true. Dental cost is also very expensive. That is very true. Okay. Now, I'm fortunate, uh, and I see here there's another comment. I have my husband's insurance from this job. Okay, that's wonderful. That's great. Okay, now the way it functions with municipal employees, um, we have what's called HMOs, which provide for medical coverage, like doctor's appointments and other procedures that needs to be done. Now, when it comes to dental benefits, we're fortunate because um, that's covered under my local, which is SSE Local 371. So we don't pay anything for most routine procedures regarding dental work. Okay. And if we do have to pay, it's usually not a lot. And also, when it comes to prescription coverage, that's also covered from our welfare fund as well. Okay. And just to let everybody know, I'm also a welfare fund trustee. Now, I'm going to continue with the article. Kaiser included healthcare maintenance organizations, HMOs, PPOs, point of service plans, and high deductible health plans with saving options in arriving at the average premium figures. It found that PPOs were the most common plan type, ensuring 47% of employees. HDHP/SOs cover 31%. Now, what I'm going to do is now the average um, premium for an employee in 2020. Uh, for family members, it is $5,588 annually, which is $466 per month. For individuals, the premiums is $1,243, which accounts for $104 a month. Excuse me. Yeah. Yeah. Excuse me. Of course, whatever employees spend on their workers' health insurance leaves less money for wages and salaries. So workers are actually shouldering more of their premiums than these numbers show. In fact, one reason wages have not been risen much over the past 2 decades is the healthcare cost has risen so much. At the same time, because employees get paid health insurance premiums with pre-tax dollars, their burdens can be less than the people who buy their own insurance through the federal health insurance marketplace or the state health insurance exchange. For the purposes of this article, marketplace and exchange are synonymous. Okay. Yeah, thank you very much. To be perfectly honest, I was planning to cancel the stream, but I do thank you. But I do feel that I do need to um, do these streams on a regular basis because I do care about my audience. Okay. Well, thank you very much. Okay. Which type of plans employers choose affect their premium deductibles, choices in healthcare providers and hospitals, and whether they can have healthcare savings account among other choices. For families which both spouses offer employer health insurance, a careful comparison is critical. One plan may be better deal than another. The partner whose plan is not used can pocket the part of their paycheck that isn't withheld for medical coverage, or a couple with no children may decide they should not opt for their own company's plan, as individuals' coverage for couples rarely involve any sort of discount. It's basically a doubling of the individual rates. Now, 56% of the offered firms offering healthcare coverage, at least in some form, to workers in 2020. Now, individual health insurance premiums are on the exchanges. The Federal Insurance Plan Marketplace at healthcare.gov, aka Obamacare, is alive and well in 2021, despite years of political false effort to kill it. It offers plans from about 175 companies. Some strong states and the District of Columbia operate their own health exchanges, which basically where the federal site focus on plans available to their residents. People in these areas sign up through their state rather than the federal exchange. Each available plan offers 4 levels of coverage, which is with own price. In order, the price from the highest to the lowest. They are often labeled platinum, gold, silver, and bronze. The benchmark plan is the second lowest cost silver plan, available through health insurance exchanges given area and can even within a state where you live. It is called the benchmark plan because the government uses along with your income to determine your premium subsidy, if any. The good news prices is going down a bit according to the Center of Medicare and Medicaid Services. The average premium for the second lowest cost silver plan decreased by 4%. Healthcare.gov from 2019 to 2020, a 27-year-old. 27-year-old. 6 states experienced double-digit percentage declines in average second lowest cost silver plan premiums for 27-year-olds, including Delaware 20%, Nebraska 15%, North Dakota 15%, Montana 14%, Oklahoma 14%, and Utah 10%. And from 2020 to 2021, the average second lowest cost of silver plan decreased by 3% for a 27-year-old. Four states, Iowa, Maine, New Hampshire, and Wyoming have average premium plan premiums decreasing by 10%. The American Rescue Plan Act of 2021 also instituted a special enrollment period for the marketplace plans from September 15th to July 31st, 2021. For new consumers selecting plans through the healthcare.gov during this time, the average monthly plan premiums fell 27% from $117 to $85 thanks to the expanded subsidies. It also helped to lower other pocket costs. Deductibles fell almost 90% from $450 to $50. However, it's not universally good news. For some details, we consulted the CMS's 2020 Health Insurance Premium Landscape Issue Brief. It indicated that 27-year-old buying silver plans saw their premiums increase by 10% or more in Indiana, Louisiana, and New Jersey. More importantly, it reveals that percentage changes don't tell us much on what people are actually paying. Some of the states within the largest decreases still have relatively high premiums, and vice versa. The brief states, for example, while Nebraska's benchmark plan decreased by 15% from fiscal year 19, plan year 1919 to plan year 2020, the average 27-year-old plan 2020 benchmark plan premium is $583. On the other hand, while Indiana average plan year 20 benchmark plan premium increased by 13%, from plan year 19, the average 27-year-old plan 20 benchmark plan premium is $314. In 2021, that trend continues. The 2021 edition of the CMS brief notes states that, for example, while Wyoming average benchmark plans premiums decreased by 10% from plan year 20 to plan year 21, the average 27-year-old plan 21 benchmark plan premium is $648, the highest in the U.S. How many 27-year-olds can afford that kind of monthly premium? By contrast, New Hampshire benchmarks plan for a 27-year-old is the lowest in the nation at $273. Okay, what I'm going to do is I'm going to put the link again. If anyone wishes to join the panel, they may do so. If anyone wants to discuss regarding the situation regarding healthcare costs in their states, they're more than welcome to share their that information. Okay. All these numbers apply only to the 36 states whose residents buy plans through the federal exchange at healthcare.gov. Residents of California, Colorado, Connecticut, Idaho, Maryland, Massachusetts, Minnesota, Nevada, New Jersey, New York, Pennsylvania, Rhode Island, Vermont, Washington, and Washington D.C. buy insurance through the state exchange. So now I'm going to be talking about the importance of subsidies. The good news is that many who purchase marketplace plans will pay lower premiums through what the government calls advanced premium tax credits, otherwise known as subsidies. In 2019, 88% of the people who enrolled at healthcare.gov were eligible for advanced premium care tax credits. What are these subsidies? They are credits the government applies to your health insurance payments each month to make them affordable.
Essentially, the government pays part of your premium directly to your health insurance company, and you're responsible for the rest. As part of the American Rescue Plan passed in March 2021, subsidies have increased for lower income Americans and extended to those with higher incomes. The ARPA expanded marketplace subsidies above 400% of the poverty level and increased subsidies for those making between 100% and 400% of the poverty level. You can take your advanced premium care tax credit in one of three ways: in equal amounts each month, more in some months, less in others, which is helpful. If your income is irregular or as a credit against your income tax liability when you file your annual tax return, which which could mean you owe less tax or get a bigger refund. The tax credit is designed to make premiums affordable based on your household size and income. Your credit is based on estimated income for the year. So if your income or household size changes during the year, it's a good idea to update your information. And healthcare.gov, by the way, so your premium credits can be adjusted accordingly. That way you don't have to have any unpleasant surprises at tax time, nor will you pay higher premiums than you need throughout the year. Okay. Now we're going to be talking about how insurance deductibles. Okay. On top on top of premiums, everyone who carries health insurance also pays a deductible. This means you pay 100% of your health insurance expenses out of pocket until you pay the pre-return amount. At that point, insurance coverage kicks in and you pay a percentage of your bills, with the insurer picking up the rest. Most workers are covered by a general deductible, which means it applies to most or all healthcare services. It is how government deductibles varied in 2020. $1,640 average general annual deductible for a single worker employee plan. $2,295 average annual deductible if the single worker is employed by a small firm. $1,418 average deductible if the single worker was employed by a large firm. So, individuals who are eligible for cost sharing reductions, a type of federal subsidy that helps reduce the out of pocket costs or healthcare expenses such as deductibles and co-pays, are responsible for deductibles as low as $115 for those with household incomes closer to the poverty level. A note on short-term plans: if you miss the annual enrollment period and don't have one of the reasons that you qualify for an SEP, you may have to resort to buying a short-term health insurance plan that lasts anywhere from 3 months to 364 days. Because these plans tend to cost an average of 54% less than the exchange plans, according to the Kaiser Family Foundation. You may also decide to opt for one if you can afford health insurance through your employer or the exchanges. Maybe you are not eligible for a subsidy. By every way, regulations by state, but in general, you expect that pre-existing conditions won't be covered. Your application may not even be accepted if you have certain health problems. Other common inclusions include maternity care, mental health services, and prescription drugs. And be on the lookout for dollar limits on coverage. Short-term plans don't offer the same protection that exchange plans do and may not help you at all when you need coverage the most. Now, how do I find affordable health insurance? Group plans are generally cheaper than individual plans, so if you're eligible for one plan through your employer, your union, or other association, that's your best bet. in terms of coverage for money. That's not an option. If that's not an option, the public health insurance marketplace is established by the Affordable Care Act, offer affordable health insurance for individuals. In most of the U.S., you can sign up for a plan through the federal government via healthcare.gov site. However, 12 states run their own marketplaces and residents sign up at their sites. Okay. How much is health insurance a month for a single person? It depends on a variety of factors, ranging from your residence stay to your age and type of plan, workplace, or individual. Employer sponsored plans average $622.50 a month, with individuals employees paying about $105 of that. For example, individual plans by healthcare exchanges range from the average of $648 to $273 monthly. What is the Affordable Care Health Insurance Marketplace? Established by the Affordable Care Act, the Health Insurance Marketplace is a platform that offers medical insurance plans to individuals, families, and small businesses. 14 states and the District of Columbia offer their own marketplaces, also known as exchanges, while the federal government manages a marketplace open to residents of other states. Marketplace plans are divided into four categories that range in cost and coverage. Though offered by private companies, all must meet certain criteria established by the state federal government. The bottom line, how much you pay for health insurance isn't a number you can guess. It's affected by many factors, few of which you can't control, though there's a case for leaving Wyoming in search of cheaper insurance. If you buy a plan through healthcare.gov, you can use the government's tool for estimating which subsidies you qualify. Uh, if you're buying health insurance through the employer, review your option enrollment information as soon as it's available, as you'll have plenty of time to review your options. Attend information sessions and use any comparison tools your employer may offer to help you pick the most available plan you can afford. Um, if you're looking for a better way to maximize your retirement income while you're minimizing your investment tax, okay, I'm not going to read that. Um, what is okay? What is my take in all this? There are many factors involved when it comes to the cost for healthcare coverage. Now, going back to my situation as a municipal employee, every year we have a time where we can review our healthcare plans, and if we want to make changes, we can do so. Whether it be to add people to our plan or whether it be to remove people from our plan. Also, we can change the type of healthcare coverage. So we're given a whole month to consider all those options. And of course, for the most part, those changes occur in the new year. Okay. There's another article which I was going to read. Unfortunately, as you can tell from my voice, it's um, I'm not exactly at 100%. So what I'm going to do, um, if no one else enters a comment and no one else joins the stream, I'm going to cut it short because I do need to. First of all, I do need to rest my voice. Number one. Number two, I just want to let everybody know that the 18 leather is going to be doing a stream tonight at 9, 9 o'clock Eastern Standard Time. So I might participate in that stream. I don't know. I'll have to wait and see. But if my voice is still um, the same thing without any changes, chances are I'm just going to stay in the chat. Okay. and most likely people are going to watch this stream in the playback, which is perfectly fine by me. Okay, now what I am going to do, sign up. Now what I'm going to do, okay, what I'm going to do is, just give me a moment. I'm going to be talking about the streams for next week. Okay, now just to let everybody know. Now on Monday at 7:15 p.m., I'm going to be discussing what are your holiday traditions. So basically, we're going to be talking about holiday traditions because we are approaching the holidays. So we're going to be discussing what are those holiday traditions that you have. What did you observe when you was a child, and what do you observe now? Okay, so that's going to be live at 7:15 p.m. Eastern Standard Time. Hopefully by then my cold will be gone. I'll be my normal healthy self. Now on Wednesday, November the 9th at 7:30 p.m. Eastern Standard Time, we're going to be doing a shout out to the veterans. And why are we doing that? Because first of all, it is thanks to our veterans who put their lives on hold and serve in military service to defend the rights that we have. And then there are those who actually perish under military service. So it's going to be a shout out to the veterans. And then on Friday, um, we're going to have, just give me a moment. We're going to have another stream, okay? And the name of the stream is how to maintain your spirit during trials and tribulations. Now, the fact of the matter is, we all from time to time, we all go through times of difficulties, trials, and tribulations. Sometimes it could be because of the choices that we make. Other times it could be because of the circumstances that we all deal with. So we're going to have a discussion of that. I really would love to see if Jojo can hop onto the stream. As a fellow believer, I'm sure his insight will be really appreciated regarding that topic. And then um, next Sunday, it will be the final time that I will do a stream completely in Spanish, and the name of it is just going to be open dialogue. Please forgive me. I'm not going to translate into Spanish because I barely have a voice as is, and it's as you can tell. I mean, I'm not exactly at 100%. So, and I'm sure I'm going to sound like a sick puppy. Okay, but when everything is said and done, the show must go on. Maybe I would have been better off postponing the stream to another day, but nevertheless, okay. So, being that no one is going to join the stream, I'm going to start to wrap this up because my voice is really starting to crack. Okay, I do appreciate the fact that we have the presence of Art Nutso and Hazel. Okay. Next week, I'm gonna be sharing what's gonna be the theme for season 5 of Uncommon Sense. Okay, and I believe that the thing is appropriate um, because
when everything is said and done, we cannot live by the past. We cannot dwell on the past. All we can do is concentrate on now and be the best version of ourselves. Okay. So I'm gonna ask that for all those who enter a comment after the stream is over, please keep it respectable. What's gonna happen is if you do not, it's gonna be deleted. It is that simple. And one thing I do have to, before I go, I do have to make an observation regarding Gigi's string. Okay. I do appreciate the shout out, Gigi. I just want to say thank you very much. As far as hybrid is concerned, I mean, what can we say? It is, I mean, his conduct speaks for himself. His words act speaks for himself. His actions speak for himself. So that's something. What I'm gonna do is I'm gonna be the best version of me, which means I'm gonna deal with those who would deal with me. I'm gonna hang with those who hang with me. It is that simple. So that being said, I'm gonna wrap this up so I can give my voice a chance to rest. Okay. And I do appreciate all of you who allow me to enter into your devices. So I'm gonna end this stream the same way I always end it. Let us be good to one another and each other. And I apologize for having to cut the stream quickly. It's just that my voice is starting to go, and it's pretty hard to do a dialogue when your voice sounds muffled. So that being said, this has been another episode of Uncommon Sense with Jose Negron, and I wish all of you a good night.
Be strong. Be strong.